Hello everyone. Today, we are going to talk about the early signs of diabetes. At the end of the video, you will also be able to learn about the prevention of diabetes. So please watch the video to the end. Diabetes. This is a chronic disease caused by a violation of metabolic processes in the body, due to a deficiency of insulin synthesis and an increase in blood sugar levels. This disease can lead to the development of serious pathologies, and at least 25% of people do not even know that they have diabetes. The cause of diabetes, mellitus, deterioration of immunity, genetic predisposition, violation of metabolic processes in the body, violation of the adrenal glands, pancreatic disease, cardiovascular disease, use of corticosteroids, obesity, early signs of diabetes. About 25% of people with diabetes are unaware of the disease. Many continue to calmly go about their business, not paying attention to the primary symptoms of diabetes. And at this time, the disease destroys their body. In order to avoid harmful consequences, early signs of the disease should not be ignored. Before we move on to the first feature, I would like to ask you to subscribe to the channel and click on the bell. Make the subscribe button turn into a subscribed one. So, let's move on to the first feature. Increased thirst and frequent urination. These are the most common symptoms of diabetes mellitus. With this disease, the body cannot cope with a high blood sugar content. The kidneys cannot absorb all the excess sugar. As a result, sugar enters the urine and takes with it fluid from other body tissues. The body tries to remove excess sugar, which leads to frequent urination and gives a feeling of dehydration. Dry mouth persists for a long time, even with the use of a large amount of liquid. There is a constant feeling of thirst. The result from drinking water, tea, or juice is zero. I'm always thirsty anyway, and it doesn't matter if it's summer or winter. In an attempt to quench thirst, the patient begins to drink even more liquid, which leads to even more frequent urination. These signs may appear after a meal, be provoked by the intake of carbohydrates, or very sweet food. You should not try to quench your thirst with cool drinks and juices that contain an increased amount of sugar. A completely healthy person walks in a small way, on average from 6 to 10 times a day. Frequent urination and a significant excess of this indicator can cause inconvenience in everyday life. This can be an alarming sign that it's time to visit a doctor. Itching, as mentioned earlier, excess sugar is excreted from the body through the urine. It takes with it fluid from other tissues, mainly from the skin. As a result, the skin, deprived of a sufficient amount of fluid, dries up, begins to peel and itch. Combing dry areas of the skin can lead to injury and infection. Diabetes requires special care that keeps the skin hydrated and healthy. Darkening of the skin. In addition, the skin can change its color, blackocathosis. This is a condition in which dark spots with a velvety texture appear on the skin. High blood sugar levels cause serious damage to blood vessels, damaging them. Dark spots in most cases appear on the folds of the skin. Particular attention should be paid to the elbow area, armpits, groin, the back of the knees, neck and knuckles. Unexpected darkening of the skin in these areas is an early sign of diabetes and prediabetes. Increased hunger. Constant feeling of hunger. This is the fourth most common symptom of diabetes. If the body does not produce insulin, it produces it in insufficient quantities or does not react to it properly. It cannot process food into glucose, from which it takes energy. Subsequently, increased hunger does not go away, even after eating. In fact, food only contributes to an increase in blood sugar levels, which worsens the overall situation. If you have a constant desire to have a snack, you should consult a doctor. Chronic fatigue, loss of physical strength, exhaustion, and weakness. This is another common symptom that signals the presence of diabetes. Mellitus, a person constantly feels tired and weak, as the body's cells do not receive enough glucose, which can be used as energy. The body loses vitality due to a violation of the function of insulin production, as a result of which it does not receive the necessary nutrients in sufficient quantities. They are poorly absorbed. This can lead to weight loss, insomnia, and decreased performance. In addition, dehydration against the background of frequent urination also contributes to fatigue. It causes the need to wake up in the middle of the night in order to go to the toilet. As a result, the body does not have time to recover its strength, and a person cannot enjoy a healthy and healing sleep. This leads to a general depletion of the energy level in the body and provokes a state of irritability, numbness, tingling in the hands and feet, numbness, pain, or tingling of the extremities are another common sign of diabetes. Elevated blood sugar levels lead to circulatory disorders, which can damage nerves. The arms and legs primarily take the blow on themselves, since they are further from the heart. Numbness can lead to decreased sensitivity. The lack of pain is a big problem for people with diabetes, as it can lead to the development of a diabetic foot. Numbness is accompanied by impaired blood supply, as a result of which the tissues are not saturated with oxygen in sufficient quantities, and regenerative processes slowed down. If the numbness of the arm legs is ignored, then the lesion progresses, and often this causes a violation of the active activity of a person. Uncontrolled mood swings and bouts of anger. A disturbed blood sugar balance affects a person's state of mind. People in the initial stages of the disease, or those who are unaware of its presence, may suffer from constant mood swings, unexplained bouts of rage, or depressive states. Vision problems? If blurry vision is not associated with eye organ pathologies, this may be an early sign of diabetes. Vision becomes blurry due to the displacement of fluids in the eyeball, as a result of which the lens begins to swell and change shape. Vision becomes blurry and indistinct. It is difficult for the eyes to focus on any object. Also, the eyes may begin to double, or there is a feeling of fog and sand. In most cases, these changes are reversible, and vision returns to normal as soon as timely treatment normalizes blood sugar levels. If diabetes is not treated in time, the changes can progress and lead to complete loss of vision. Sudden weight loss, unexplained weight loss, does not appear with exercise and diets, but is a common early sign of type 1 diabetes. But in some cases, it also manifests itself with type 2. Diabetes mellitus can easily pick up from 4 to 10 kilograms in a few months. Weight loss in diabetes is due to the fact that the body cannot use glucose as an energy source and instead begins to burn fat and muscle tissue. The body does not receive enough insulin to break down food and absorb valuable substances and calories. The kidneys may also suffer. In order to remove excess sugar from the body, they have to work much harder. Weight loss can contribute to dehydration. In diabetes, the body uses all possible fluid in an attempt to produce urine. Slow wound healing against the background of elevated blood sugar levels, inflammatory processes in cuts and wounds increase, and blood circulation is disrupted. As a result, the blood does not get to the damaged areas of the skin well and restores them for a long time. In the presence of skin itching, it is necessary to be careful, since wounds that appear as a result of combing can take a long time to heal, and infection can get into them. If cuts and wounds take longer to heal than before, it is necessary to report this at a doctor's appointment. Cramps in the legs with the development of diabetes mellitus, a person can suffer from convulsive pains in the lower extremities. Often they appear in the evening and at night when the legs are motionless for a long time. Frequent night convulsions do not allow the patient to rest, take away a full sleep. Its lack leads to exhaustion of the body and the development of other diseases. Symptoms of spasms in diabetes mellitus are manifested as follows: goosebumps on the skin, burning sensation in the shin area, discomfort and painful sensations in the legs, hair loss. Diabetes is a stressful situation for the body. Emotional reactions to lifestyle changes, dietary restrictions, and worries about your health can contribute to hair loss. With an increased level of sugar in the blood, there is a decrease in the immune response of the body. As a result, this leads to an active proliferation of microorganisms and fungi on the scalp. Such a disease contributes to delayed growth, thinning, and loss of hair. The reduced ability to restore leads to the fact that a new hair grows very slowly or does not exist at all in place of the fallen hair. Prevention of diabetes mellitus. Healthy people are recommended to undergo an examination every 3 years and adhere to the following rules: maintain a normal weight, engage in physical activity, perform at least basic exercises, consume less sugar and saturated fats, do not smoke, do not drink alcohol. This is the end of the video. On the channel you can find many interesting videos about the benefits and harms of vegetables and fruits, as well as about diseases and ways to treat them. Therefore, please do not forget to subscribe to the channel and click on the bell. I would also be grateful if you like and share the video with your family and friends. The Bioverse channel was with you. See you soon.